Hello, and a hearty welcome to everyone joining us remotely. Of course, also to my guests today, who I'm hosting on behalf of Jonathan Ball Publishers and News 24. I am Samantha Herbst, a podcaster, journalist, and book fiend who has across from me today, will be joined shortly by three distinguished academics, each with an impressive resume, which includes the title of author. My guests are the editors of a book dedicated to the nurses of South Africa. In our own words, Nurses on the Front Line is a collection of stories that showcases the mettle of our nurses during a time that required near superhuman bravery, as well as a hell of a lot of strength and resilience. So, as we all know, the COVID-19 pandemic reared its very ugly head over the course of 2020 and 2021. But to be fair to those still in it, it still continues. The project was initiated by my three guests, and I will briefly introduce them now before I start picking their brains on the ins and outs of this project. This book serves to not only spotlight the work and the sacrifices of nurses on the front line, but also brings to light some chinks in the rusty armor of a tired medical fraternity who are still fighting the good fight on behalf of South Africa. And we're here to find out where to from here. But first, let me introduce our three guests. Welcome. Professor Jonathan Jansen, you are probably the most recognizable in the crowd. So, hello, Prof. I'd like to introduce you, although you are one of those who needs no introduction. Professor Jonathan Jansen is a best-selling author, columnist, and self-proclaimed troublemaker who likes to stir the pot here in South Africa. Prof. Jansen is currently the Distinguished Professor of Education at Stellenbosch University and President of the Academy of Science of South Africa. Of course, his work output during the slump of the 2020 pandemic did not begin and end with this book. He published two other related books while the rest of us scoffed banana bread and bemoaned the mask regulations, Learning Under Lockdown and Teaching in and Beyond Pandemic Times. But, Prof, you didn't do this alone. This book, in our own words, would not have come to fruition without your co-editors. Sadine Kutsia is the first. The Albertina Sisulu Research Chair in Nursing Science at Northwest University. Sadine, your research focuses on nurse outcomes, specifically the recruitment and retention of a satisfied, healthy, and committed nurse workforce for South Africa. This is why we're here, guys. Welcome.
Thanks very much.
And then we have Professor Hester Klopper, the Deputy Vice Chancellor of Strategy, Global and Corporate Affairs at Stellenbosch University. Hester is also a professor in the Faculty of Medicine and Health Sciences and has dual fellow roles at the Academy of Science of South Africa and the American Academy of Nursing. Welcome, Hester.
Thanks so much.
So, Sadine, you apparently got this book underway. Talk to me about the initiation of the project and then how you guys, the three of you together, went about collecting stories of nurses who were still in the thick of it when the call went out.
Okay, so initially I got the idea with Prof. Jansen's book, Learning Under Lockdown. So I saw the call on Facebook and a mom of a grade 1. I immediately thought, wow, that's a very good project. And then I started thinking this would be very well applied to nursing because I think just like scholars, they're a voice that's not often heard. So I called up Prof. Klopper. We've been looking at some time of how we can recognize nurses in this time. And I talked to her about the idea, and she was initially very much on board. And then we decided to contact Prof. Jansen because obviously, I mean, he has experience of doing this project and he was also very excited to join. Yeah, and that's how it came together. So we had an initial idea of how we would make the call, and we just put out on Facebook and Twitter and Instagram, we sent out a call of what was their experience, 80 nurse, what was the experience of serving on the front line during COVID-19 pandemic, and what advice would they give to people that are on the front line and still serving and will still serve. And that was, the call went out 1st of June. So that was really in the thick of things. And then the end of the call was the 31st of August. So we had 75 submissions. And I mean, it was it took us some time to get through those stories. I'm telling you, you can't read really 2 or 3 more than in a day. So we chose 28 in the end. And how we did it is we took the 75 stories, anonymized it, and each of us worked through it independently. And then we rated which story should go into the book. And the decision was basically, we didn't want to traumatize the reader. We really wanted to show the courage of nurses. We wanted to show, also celebrate the profession, and also just highlight where there are gaps. Even before COVID-19, we saw there's a lack of staff and a lack of nurses. So where are we now after the pandemic?
So these stories, you mentioned not wanting to traumatize the reader. Look, and I'm with you that I couldn't get through more than a couple of stories at a time. I really had to let it sink in, and it was traumatic, but also very visible. It made some of the trauma I experienced, even as someone not in the front lines, made that visible, and it really brought out the empathy in me for the people who did work on the front line. So I think you guys were very successful in that way. You divided the stories into 3 sections: trauma, resilience, and growth, which successfully offers a light at the end of this very dark tunnel. But as I mentioned, it doesn't silence the nurses' harrowing accounts of trauma. So, Jonathan, I wonder if you can answer this question. This is a cohort of people who were already at their wits' end when the pandemic struck. Considering, especially and in particular, what's mentioned in the book, the shortage of ICU nurses, was the severity of burnout across these stories that were submitted as severe as the 3 of you expected?
Well, I'm the only non-nursing professor or professional in this group. So I experience these stories perhaps a little differently because I don't know the world of nursing apart from the fact that my mother was a nurse and I saw a bit of that. What really struck me, perhaps for the first time, was that this is perhaps one of the few professions in which people rushed towards the fire. With the crisis hits, the pandemic hits, and remember, in the early days, we actually didn't have a lot of knowledge about the effects of this particular virus and so on, and so everybody proposed all kinds of dramatic interventions, the social distancing, the hand washing, all of that, simply because we didn't know enough at that point. Long before we even knew it was primarily a respiratory disease. And in that cloud, under that cloud of uncertainty, everybody sort of retreats into, the comfort of their homes, into isolation, behind their walls. But the nurses run towards the fire. And that hit me big time as I read these stories. I mean, you sort of know it intellectually, right? But you don't really know it emotionally. You really don't know those stories spiritually. You don't know those stories, personally, until you read these stories. And I tell you something, I was astounded by the courage. I was astounded by the determination, to sort of say, we might not know much. Yes, our lives are in huge danger here. We have families and we are so concerned, but we have a duty to care. And I can tell you now, that blew me away.
So ironically, 2020 had been earmarked by the World Health Organization as the year of the nurse. Nurses were supposed to be celebrated. They were supposed to be visible. They were supposed to be seen for the work that they do. And as I mentioned, it's incredibly ironic, but these stories really bring forth the anxiety and the stress and the conditions under which our nurses operate. And look, we do have initiatives like Crazy Socks for Docs and stories shared through the height of the pandemic, brought to light what the medical fraternity was going through. But I'm not sure that it really, until I read this book, I'm not sure that the PTSD and the depression and the levels of anxiety endured by the nurses was really brought home in the public during that time. There was some support. It is mentioned in the book. But what's equally mentioned is how nurses didn't felt a lack of support. Hester, I wonder if you might want to answer this. The book suggests that there was some support, and when there was support, it wasn't the right kind of support, or it wasn't as effective as it could have been. What do you have to say in terms of that, in terms of psychosocial support and um, resources and lack of resources during that time for nurses?
Well, I think if we listen to the stories that we've seen in this book, what is evident is indeed that there's different levels that we need to look at. First and foremost, from an individual perspective, then in terms of the family of these nurses, in terms of the hospital system that they were working in. But when I engaged with the stories originally, it reminded me indeed of the Kubler-Ross cycle when we experience trauma. And this is exactly what we've seen playing out with these nurses, where there was first the anger, the denial, the depression that followed. And I think we're still not through it. If we think of the Kubler-Ross cycle in terms of coming to terms with what really happened during this period. So in terms of support, we would have seen in the stories the need of the nurses to really go home and actually be able to engage with their family. But because of the worry that they would infect their family, many of them didn't have that individual contact. So they really felt isolated and there wasn't support at that level. Later on, when they realized there were some mitigating factors that they could limit in terms of their actions, then it became easier for them. And of course, there were some in some of the stories we read that their family, no matter what the issue was, that they felt that they would want to engage with these healthcare professionals. When we think in terms of the hospital system, I think what we've seen in so many of the stories is that the nurses really felt there was a lack of support from the management. And I must honestly say, I do think it was because of the uncertainty. Even from a management perspective, there was knowledge about it, but living through a pandemic has just never happened in our lifetime. So it was also trying to understand how to prepare in terms of, for example, the personal protection equipment, the lack of that we originally saw, and then the demand, and they were waiting for that. And then there were also a number of different opinions in terms of what would be the best way of handling it within the clinical setting. So a lot of confusion also existed. So I don't think it was an intention of not being supportive. I think it was the uncertainty, the unknown, and that everyone was in this together. However,
There are some managers. Sorry to interrupt you, Hester. There were some managers in their stories that were included in the book, and they speak a lot to that uncertainty, and how they also, in addition to their responsibility, their regular responsibilities, they felt doubly responsible for having answers to COVID, which none of us had answers to at that time. It was an unrealistic expectation demanded of management.
Yeah, absolutely. And I mean, it was exactly because they were also on the receiving end. If we look at the numbers of nurses that we lost in South Africa, and that's the latest numbers I saw was more than 1,300 healthcare professionals. And it was amongst right from nursing professors, it was in the front line through all the different categories of nurses as well as doctors. So everyone was at the receiving end. I think the important lesson for us is how do we move forward? And that's what I would like to see that this book highlights, is taking the lessons from what we've seen and putting systems in place for the future, initiatives to make sure that we do provide care for our nurses, and especially in terms of mental health. I know that in some of the private hospital groups, they've started with such initiatives, but I haven't seen some of those initiatives in the public sector, and I think it's critical.
So speaking to that, like I mentioned, as editors, you divided the stories into 3 sections: trauma, resilience, and growth, with stories speaking to each of those 3 topics. But the sections were followed by reflections and a conclusion with, as you mentioned, his suggestions from what you glean from the stories of ways of moving forwards. And I love this idea that this book, this text, not only serves to share personal stories in the nurse's own words, but uses the experiences of the nurses to ask 2 things. What did we learn? And what can we do better? And this is as a collective, right? This is not just nurses. This is management, government, and citizens, family, and the community surrounding people who offer us healthcare services. So, Sadine, we haven't heard from you in a while. Seeing as your primary research focus is on nurse outcomes, I wonder if you'd like to speak to the question of what did we learn from these stories?
So from the research I've been involved in, I've learned that the most important thing really is the leadership and support of nurses. And within that is really the acknowledgement of nurses and the celebration of nurses. So I think that's what I've learned from this book is if you saw what nurses were thankful for, it was my manager thanked me, or someone worked beside me, or the community. They speak about the creches that brought them letters and the food. So it's that acknowledgement of we're in the front rows of this war, and people are seeing that. People are seeing our sacrifice, and they're acknowledging what we're doing. So I think that's a very important thing. As well as I think within my research, what I'm seeing is with nurses, when you're in the trauma situation, like think of any of us in a car accident. When you're in that car accident, you know the following steps have to be done. You have to phone the police. You have to make a case. So when you're in it, you're really just responding out of the situation you're in. You're not really thinking about it. And at that point, we try to give intervention to nurses. But they're really in a response of, this is what needs to be done. There's patients dying. I have to be by the side. I'm not thinking of myself. But now, where we see really there's less patients in the wards, one thing, but also less demands on them emotionally. Now you're seeing that nurses are really breaking down. Now is the time they're really struggling. I heard back from one of the nurses that said, when I read this book, I was in tears, because sometimes I think back to this time and it feels like it never happened. It was all a bad dream. And just your stories make me realize I wasn't alone. And now as masks come off and they actually see what the nurses that worked beside them looked like, you must remember many of them were contract workers at that time. So they didn't know each other before COVID. And during COVID, you never saw each other much without a mask. So just that acknowledgement of this really happened. I think that is my take-home message is, please, if we think we've done too little during the pandemic, now is the time we should be looking after our nurses. Now is the time. If you have a nurse in your family that you're supposed to be looking out for signs of burnout and depression.
In the book, you mention, as authors, you mention that US veterans are recognized just by the insignia. And we see nurses in our shopping malls. And one of the calls to action in the book was to thank our nurses when we see them out in the wild, at shopping centers, or when we go to healthcare facilities and they draw our blood. Make sure that you do thank the nurses. That was a key takeaway for me. Not one of the key takeaways, not the only key takeaway. Hester, you spoke to sort of a way of moving forward. So that was the second question. That the book concluded with, what can we do better? How can we do better?
Now, if we look at what the WHO recommends in terms of the indicators for the workforce impact assessment, I think all of those 6 elements speak to exactly what I think should happen for the future. The first point that they address is in terms of turnover. Now, in South Africa, especially in some of our healthcare facilities, we don't have the tracking of turnover and what is the real percentage in terms of attrition, but then part of turnover is also the issue about retention. And what we've seen globally is actually this flux of people leaving the profession. Now, it's very interesting, and Sedina and I did research more than a decade ago where we actually looked at what was nurses' intention to leave the profession at that point in time, and it was as high as 54%. My take would be if the pandemic has even increased that further, and that really leaves us at risk in terms of our profession. So the first point really in terms of turnover. The second dimension I think is critical is ensuring stability within the profession. And that is really, in terms of stability, the nurses' choice to stay in the profession. And of course, there's different aspects that we need to keep in mind in terms of how do we provide, well, first, good salaries, but then the other opportunity for their own development, which I've also seen in the last couple of years in some areas of our healthcare services not received attention. The third point is tracking the absenteeism. And that's another part that I think is critical in terms of ensuring stability for the future. The fourth point I want to highlight is around applicants for the profession. I think the COVID has really shown us that nursing is not only a profession in terms of earning a salary, but it's indeed a calling, and that you need to have the heart to serve people more now than ever before, and being there and presence, mindful presence in terms of your nursing practice. And then the last point I want to raise in terms of for the future, the workforce is we've got a challenge in our country, and that is in terms of the high vacancy rate. So we see that there are, and Sedina just referred to that now, where quite a high number of nursing staff were given part-time positions and contract positions. And as soon as the COVID numbers started dropping, they are out of positions. And the issue is really that within government, there are thousands of vacant positions, but not funds to actually employ these professional nurses. And that's a challenge for a country like us where I would say, well, if we look globally in terms of healthcare professionals, nursing typically makes out between 60 and 70% of a country's workforce. So it's nurses who is a key factor in terms of quality care. And more so on the continent of Africa and in our own country, where we are dependent on primary health care, where nurses are often the first point of entry. And they provide that care within communities. And that now, as we've seen, has filtered through to hospital systems. So just to touch upon some points that I think is critical for the future.
Gosh, we are going to circle back to that on ways of moving forward. But this is a book launch. I do want to touch on the enjoyment that I got out of reading this book. And I wonder, Jonathan, if you want to tackle this, as it's not your first rodeo in terms of publishing. There are some aching anecdotes in this book, which are as heartbreaking as they are beautiful. And I was surprised to find, I shouldn't have been surprised, I suppose, but I was surprised to find some common imagery and phrases that served as a golden thread throughout the book. And that, I'm sure, is the hard work of you as editors that managed to really bring those common threads to light. Things like eyes, where there's either mention of tears or averting a gaze or twinkles in the eyes, or how you could see the smiles, because for however many months we were behind masks. Masks was another image. Suffocation, shortness of breath, the weight on your chest, which has to dual function as mention of COVID and mention of sort of the anxiety and fear. And then, of course, guilt, moral trauma, not feeling good enough in your work or at home. These are the stories of nurses. So, Jonathan, I wonder, was that perchance that these were common threads between the stories? Were you as surprised to find that when reading the stories? Is it something that you drew on and use those threads to really tell the story of the nurses?
Yes, we are very much guided by the metaphors, the ideas, the voices of these nurses. That's what editors do. The whole idea was not to write our story, it was to write their stories using their words and drawing attention, as you said, to themes, that emerged from each of the stories and then in the different groupings. So for me, I suppose the one thing, partly because in part of my family, part of my family suffers from asthma, and as you know, with asthma, the notion of breath and of breathing is a very powerful and disturbing kind of variable, in the lives of asthmatic patients. And so when I read the stories about breathing, it really made me realize how incredibly anxious those patients must have been, as their breath literally, in many cases, just went away. And so here you have this nurse at the intersection of several kinds of anxieties. The one is the patient, the other is the patient's family who cannot be there, and is either on the phone, on a cell phone, or behind some other, barrier. And then, of course, there's the nurse's own life. And then, of course, what happens when I go home to my family, if I can go home. Now, imagine you, the nursing professional, you're the one constant here that has to manage all of these different things. And right in front of you, you have somebody struggling for breath. You then have to tell the family what the state of the patient is, and then if the patient dies tragically, then you have to worry about your own self. That hit me, and the words that, as you correctly said, the words that the nurses used were so evocative. It drew something out of you. You couldn't but be empathetic. You couldn't but feel scared as well, even as you read it. And you couldn't but, in seeing how they responded, be incredibly hopeful. I just want to say something briefly in relation to what my colleague Esther said. I think if this book doesn't draw attention to the fact that we have, and I'm saying this as somebody who's not in the nursing profession, but who's very keenly aware of the downfall of our public hospitals, and you've seen all the stories, right? If this book doesn't tell you that you need to pay nurses more and improve the conditions of their service, then I don't know what else it's going to do. Yeah, since 1918, okay, since the flu epidemic, you have a real life, dramatic, life, threatening episode, pandemic. And if this doesn't tell you that you need to value, you see, a profession is only gains its status to the extent that the public values its work. And if this didn't draw attention to the value of the work of nurses, and therefore the need for compensation, the need for remuneration that solves the vacancy problem, that brings young people into this profession, then God help us when the next pandemic comes around.
Yeah. On that note, I would like to say that the book includes 7 drivers for growth and resilience. And if you aren't listening to these 3 editors as professionals, then I'm not sure where we are going in moving forward. So the key factors, stuff like workload, and job demand, staffing and resources, control and flexibility. There are 7 key drivers. They are factors that can make or break any work experience. You, as the authors, use the stories to glean insight into potholes, as I mentioned before, the chinks in the armor of medicine in South Africa. But you also acknowledge at times what was done right, and as we mentioned, what can do better. But Prof. Jansen, Jonathan, it strikes me as poignant that the book was being finalized when the public letter by pediatrician Dr. Tim DeMeyer to the National Department of Health was published in the Daily Maverick, swiftly followed by his subsequent suspension, but let's leave it at that. Do you have any comments on that? How the key drivers for growth and resilience put forward in this book might dovetail with the issues brought forward in DeMeyer's letter?
Yeah, I mean, I'm a great fan of the courage of that, of DeMeyer. I think more of us need to speak out. The reason he gets targeted is because not enough of us speak out, you know. And this book is a way of speaking out. But you know why the department retracted on their cowardice is precisely because ordinary people across the board, and I jumped in myself, said this is unacceptable. This is democracy. Here you can actually say what you feel and what you believe and what you care about without being threatened by bullies. So the story there that really this, you saw the same, by the way, with Linda Gray. Remember when Professor Linda Gray spoke out and some idiot in the Department of Health, the Ministry of Health, tried to silence her? We stood out. The Academy of Science, of which I'm a member, we said this is unacceptable. So provided the public pushes back against this tendency towards authoritarianism and not hear the plea of the health practitioner, whether it's a doctor, a nurse, whoever, if we start to deal with the lament of people who are struggling to keep this health system alive, if our hospitals are still going to be kept functional with gift of the givers, you know, drilling a borehole to just give one of our public hospitals water, my goodness me, if the response to that is to bully people and intimidate them, we as a public must push back against these tyrants and remind them, okay, that the appropriate response is to say, let's listen to these nurses in this case, let's find out what we can do better, let's express some humility in policy and in politics so that we can serve our people better. Because at the end of the day, the person who suffers, as you know, is the patient. And the person who suffers greatly, as I discovered through these stories, are the nurses whose hands are tied and they don't have power, you know, to bring resources to impact on the results. And so, yeah, so as I said, you know, I do see this book as political with a small p, in that it draws attention to inequality, it draws attention to inadequate services, it draws attention to the fact that we can do a much better job of supporting the nursing profession.
So over and above those key drivers and suggestions mentioned at the end, conclusions, drawn, there were a few passages in the real life stories of the nurses that were included, again, in their own words, that had me in tears, several. So thanks to the three of you for having me had to explain some tough times during, sitting at a coffee shop trying to work through my work. And I had to say, I'm a journalist. Nothing serious is happening to me, but I'm being torn apart by real life stories happening here. And I'd like to share an anecdote so that you know that even me, I'm a journalist, I'm not in the medical fraternity, but this had such an impact on me. So there is a nurse who was a contributor, and she was the NICU nurse who admitted my firstborn at birth when he couldn't breathe. She was a nurse who supported my husband, who had to leave me, his wife, on the cutting room floor, for lack of a better term, and he had to go with the NICU nurse and my child, who might not have survived the night. And she contributed to the book. She supported our family in a way that I could never repay her. She won't even remember, probably because she's done it so many times. She lives and breathes experiences like that. For me, one of the single most harrowing experiences of my life. And then, of course, not of course to you all, but I birthed my second son in 2020. And like everyone, any reader, anyone listening, lost some special people in my life that year over the course of 2020 and 2021. So these stories, they get pretty personal pretty quickly. And that was my, sort of anecdote, what struck a personal chord with me. And I'd love to know which anecdotes or stories or even passages struck a chord with each of the three of you. Sadine, can I call on you next, maybe to share something that really hit home for you personally?
I think for me personally, there was 3 stories that I immediately think of when I sit here. The first one was, and we actually looked at the title of the book in this line of, she said, no one dies alone. So for instance, if she had to go to the bathroom or something, she made sure that her colleague would know she's leaving, so that to make sure that that patient would not be alone where they were now suffering for their last breaths and things. So that was something to think about, how important and how they planned, like just that this person would not be alone, like holding their hand, being beside them. So that was one. The second one that it took me several days to get back to the book was, it was a nurse in the ICU, and she had a colleague that was working alongside her in the ICU, and then this nurse ended up being in the ICU as a patient, and she passed away. And just, that if you can think about the trauma of a colleague working beside you and then dying, and her bed just being replaced by another patient, and there's just no intervention between that, because there's no time. I'm sure they did interventions later on, but in that moment, you had a friend that died on the bed, you were just helping, and there's a new patient there. That was something that was also just hit me so hard. And then something I never thought about was just the practicality of being in this PPE the whole time, protective equipment, was, like basic things like taking a drink of water. They had to account for the fact that if I drink water, I need to go to the bathroom there. That means I must take off this protective equipment. That means I expose myself. That means I expose my family. She also says that, the patient dies, and she tells herself, don't cry, don't cry, don't cry. You can't wipe your tears. So I think those are 3 main stories that just stick in my head. And we also had a nursing organization manager that said, she wanted with everything in her to be beside the nurses fighting for these patients' lives, but someone had to work through all the policies. She was on her phone 24/7. She didn't even go to the bathroom without her phone. Just, we don't think about how this looked in everyday life for these people. So I think those are stories that have just changed my life forever.
Hester, was there something that struck a personal chord with you?
Absolutely. When we initiated this book, part of what we hoped we would have achieved was to give a glimpse of what nurses were experiencing in the workplace. Especially, we've seen so many of people losing their loved ones within the hospital, and they could never greet them. And that's the one that stood out for me, is the one that Sadina also referred to, where the nurse says nobody should ever die alone. But understanding why it happened, reading the stories in this book, I hope will give some sense of how tough it was for the nurses on the inside as well. The other story that really stands out for me, and I want to read this exactly from the book, where it says, I see your eyes looking straight back at me. You say nothing, but your eyes say everything. And reading through these stories and the theme around eyes, and how one had to respond to either the hurt, the trauma, sighs of relief when somebody was resuscitated successfully. All of those stories, reading it in eyes, was just something that really touched my heart. And I hope that people reading our book will have the same experience, and also have empathy with what nurses went through during this very tough time.
On the topic of eyes, I actually earmarked this, that a nurse said that closed eyes were easier than dead eyes, fearful eyes, or empty eyes. It's so harrowing, but so important. There are times in life that we do need to look at the hard things. Sometimes the hardest things to talk about need to be aired. Jonathan, you have mentioned asthma, and your mother, who was a nurse. Were there any specific anecdotes other than than those images or those thoughts that did strike a personal chord? Was there the one particular story that you remember?
I do, and it's on page 84 of the book. May I read this briefly? The
Please.
father had to visit his wife in one ICU and his baby girl in another ICU. For 10 days, we held our breath, pleading and praying that another baby would not be left without its birth mother. Our pleas and prayers were answered, and the mother survived to take a baby home. Man, if that doesn't move you, nothing will. But here is the story. We as academics feel very uncomfortable talking about God in the course of our professional work, right? But if you did simply a word count on how often spiritual words like God, like prayer, comes up in the course of this short book, you will be quite amazed. And so I quite unashamedly say to you and to your listeners today that one of the powerful things that sustained nurses was the sense of the spiritual world, that the world wasn't just material, that there was a transcendence in their experience that kept many of them, most of them, hopeful that the mother and the baby, so to speak, would go home safely.
I would love to leave it at that, but I do have one more question. As you all know, I reviewed this book. It's up on News 24 under the book section for anybody looking for a preview or more information on In Our Own Words. It is up on the News 24 website. But there was a comment left when last I checked. And this comment was from someone named JD, who spoke to the fact that this book centered on nurses in particular. And she took issue with that, which I think if you were looking to criticize the book, that would be an obvious criticism. I'm going to read her comment out loud. And by way of conclusion, I'd love to get a response from each of you to that. So here is what JD wrote. I honestly think that while putting the nursing side in book form is only some form of recognition to our nurses, it is not good enough. It is or was not only registered staff that faced the forefront of the pandemic. What about the student nurses, nurse auxiliaries, staff nurses? Then there were cleaning staff, orderlies, kitchen staff. Every staff member, pharmacy or lab staff, they all faced the onslaught with the nursing staff. How many medical personnel literally offered their lives during this pandemic? I feel that all our staff who were affiliated in a hospital should be commended. Sadine, how might you respond to JD as an editor of this book?
So I think what I'd say to JD is the invitation did go out to all nurses. So we try to, when we worked through the stories, it was anonymized. So we didn't know whether it would be a unit manager or registered nurse. We really took all 75 stories and read through them and then looking at those main themes. So it was a call to every type of nurse, every category, every province. You'll see it's quite a spread of people that submitted their stories. But I think the crux of this is what he's asking is, how do you capture the cost? I mean, that's not even something I can answer. How do I capture the cost of some people that actually paid the ultimate price? They lost their lives in this fight. I don't think there is a way that we could capture this, and this is just a small part. So my part in that was, as a nurse, was how often do we see bad reports of nurses in the media? So as you heard in my research focus shows that the main thing that we can do is acknowledge nurses. So immediately when I saw nurses rushing where everyone else fears to tread, I thought, this must be written up in history and this must be acknowledged. And so much of our literature in South Africa, we don't focus on the contribution of nurses. So I think that was my heart in capturing nursing. They're also the largest proportion of the healthcare workers. So I think, yes, there's definitely room. We are talking about the experience of patients, their families. And I think that's what I try to do in part, was to capture the cost. But we can only do it in part.
Thank you. Hester, do you have any closing comments or a response to JD?
So of course, Sadina and I are from nursing backgrounds. We're nursing professors, so that's where we wanted to focus, especially in the light of the WHO highlighting 2020 as the International Year of the Nurse and the Midwives. And the basis of focusing 2020 on the Year of the Nurse and the Midwife was exactly around the fact that there's not enough attention given to nurses. And, sometimes we hear celebrate nurses. And I want to say, great, let's celebrate nurses. And this was a way to showcase the work of what nurses did during the pandemic, putting the spotlight on them. But I think the issue that Sadina also raises in terms of the cost is around the investment into nursing. And that's the other take-home message that I would want to really stress, that it's not just about the celebration of what has been done, but the spotlight in terms of the huge investment we need into nursing. And I hope that this book will also create that awareness amongst also our policymakers and politicians in this country.
Jonathan, do you have any closing comments?
Yeah, we did a book on learners under lockdown, and then we followed that up with a book on teachers under lockdown. I was very privileged when Sadina and Esther asked me to be involved in a book on nurses under lockdown. And my response to JD would be, do the next book. I'd like to see a book on ambulance drivers under lockdown. I think that's a trauma we haven't even talked about. The people who had to rush back and forth all over the world, by the way, between hospitals and homes. So yeah, there's a lot more stories to be told. This one is about nurses, and I'm very proud to be associated with it. But let's hear those other stories and bring those books to the forefront. And I think this is what's exciting for me as an author, is that all of us can actually bring to attention in whatever way the plight of everybody that suffered, everybody that served during this historic pandemic. And I agree, there are so many stories to be told, many angles to be taken, but let us for now focus on nurses, and not just the hurt and the healing, but the enormous hope that these stories provide to all of us.
And we'll leave it at that. In our own words, is a beautiful tribute honoring the work of nurses in the pandemic, as well as the patients that they lost and the patients that they brought to healing. This is also an informative text that serves as a guideline for a way forward, and it's certainly something for every South African to read. Jonathan, Sadine, Hester, congratulations on this contribution, and thank you so much for joining me.